Hi, my name is Scott Myers, and today I'm going to be talking about joint venture financing and oncotelic therapeutics. These are some forward-looking statements. Feel free to pause the video and read them. Brief background on Oncotelic Therapeutics. They are a biotech company that has specialized in oncology. However, they have multiple different drugs in their pipeline, including those that are effective against Parkinson's, erectile dysfunction, and COVID-19. Across the board, the clinical trial process is just expensive. And that's what it takes to get these drugs, these life-saving drugs, out on the market and into people's hands to literally save lives. It typically takes over 10 years and over $2 billion. And there is never a guarantee at any point that these drugs are 100% effective or even effective at all. One thing that benefits Oncotelic is that they have multiple drugs in their pipeline, which allows them to be flexible. If one of their drugs were to fail, the company isn't going to be completely screwed. They have other things to fall back on, which is very important. However, the downside of that is it means there's more trials to conduct and it costs a lot more money. And that's really common in the biotech industry, is that clinical trial process, but it's necessary to make sure that the people are safe. Now, what happens is most companies will, in order to raise money, is they do this through equity financing, which is the offering of shares, typically at a discount to the market value. And essentially, they issue new shares, which raises money. However, it causes stock dilution because now you have 1,000, say maybe 10 million more shares out there. Each Per share, the value of each share goes down, which then causes a decrease in the stock price and dilution, and existing shareholders are hurt. So you may purchase a stock at $1, but they continue to need more money, and so they issue more and more shares, and next thing you know, your shares are only worth 10 cents. And this kind of thing happens a lot, and potential investors actually avoid investing in these companies because they're afraid of that future dilution. They think, oh, should I wait for a little bit? Maybe because they'll dilute more. And these early investors are the ones who took the biggest risk because they were betting on a life-saving drug that really could have not worked out. However, there's another method, which is joint venture financing, which is what Oncotelic Therapeutics plans to do. One partner, in this case, is Golden Mountain Partners. They will be partnering with them to provide, Oncotelic will provide OT-101 and some key staff members as their asset, and the joint venture partner, which is Golden Mountain Partners, will provide a big cash infusion at a certain valuation, and the ownership percentage is still to be determined and still in talks and will be announced at a later date. Now, what this allows is Oncotelic to no longer be liable for OT-101 because it is being handled by the joint venture, which allows the joint venture, OT-101 will get fully developed, get pushed through all the trials, and hopefully get FDA approval, while Oncotelic is able to focus on other things such as AL-101. Now, what this does is with each financing round that this joint venture goes through, is that the value of Oncotelic's stake, while the percentage may go down because of dilution, the book value of their ownership will increase. Now, on Oncotelic's balance sheet, with each financing round, it goes up, the book value, which theoretically will then translate to increasing the market value of the stock, which will increase the market cap and the stock price. And what is important to this is that they are raising money, limiting liability, and causing no dilution to current shareholders while increasing their own stock price. Here's a quick comparison between the three main ways of funding. As we can see, joint venture is by far is the best out of the three. Debt financing, you do raise money, but you have to pay interest, and sometimes you do have to issue new shares. And you'll have to deal with dilution. You still have liability concerns. Same with equity financing. Yet joint venture, you don't suffer from any of those problems. Let's talk about Roivant Sciences. They're a biotech company currently valued around $7 billion. The way they work is they are one company, however, they develop a bunch of different drugs in different areas through spin-offs. Essentially, they start subsidiaries, and those subsidiaries go through their own financing, similar to like a joint venture. Now, what this does is it limits the liability of each spinoff because they're independent of each other. And in addition, since the spinoff itself is its own entity and raising its own money, the main holding company isn't issuing any shares, so it's not getting diluted, although the value that the main holding company has in each spinoff increases, which then increases the stock price of the main holding company without dilution. So again, this allows for non-diluting fundraising. And what is so interesting about Roivant is that since they have so many spinoffs, investors could choose to invest in the main holding company, which would be similar to like an ETF where they're investing in a basket of different, in this case, a basket of different companies or different pharmaceuticals. So their risk is a lot less, and they get to take part in the growth as a whole. Or investors could say, hey, I want to risk a little more and put their money in just straight one of the spinoffs, hoping for a higher return. So it's very interesting that it is able to cater to both investors that are risk averse or want to make a high return. And Oncotelic, to conclude, is about to go through a joint venture financing. And I think that being able to look at it and say, hey, this is going to be very beneficial for everyone involved. The Golden Mountain Partners is going to make money. We're hoping to be saving lives, and Oncotelic is going to be limiting liability, and shareholders aren't getting diluted. And I'm very excited to see what comes next, and we're on the path to save lives.